I want to check city clerk is going to be with us at 5 or 7.
She should be getting on, Mayor.
All right. Thank you.
Yeah, she's on.
Good evening.
Good evening. Good evening.
Hi, Mary.
Okay, fantastic. Okay, all right, we got everybody here from the virtual dais. I want to welcome all our city staff that are also tuning in and our Milpitas community. Certainly tonight will be another great meeting for this year of 2020, and we're gonna try to find greatness throughout all the challenges of the pandemic. Truly thankful to be here with everybody tonight as we conduct the business of the people of Milpitas. With that being said, I'd like to call this meeting to order and go to our city clerk, Mary LaVille, for the roll call.
Good evening, everyone. Councilmember Fan.
Present.
Councilmember Montano.
Here.
Councilmember Dominguez.
Present.
Vice Mayor Nunez.
I'm here.
And Mayor Tran.
Present. Thank you very much, Mary. Okay, at this time, we're gonna do our Pledge of Allegiance. If you can stand where you are, I do have a flag here so that we have a virtual presence as well. And so please. Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. And before we move to public forum, I'd like to check in with our city attorney, just for abundances of caution, if there's any announcements.
Thank you, Mayor. I just wanted to know for the council and the public, although we don't have the traditional conflict of interest or campaign contribution question on the agenda tonight, it is a requirement in our municipal code. So I will ask the question for the 3 items on your special meeting agenda. At this time, I'd ask the mayor and each council member to please disclose any financial or personal conflict of interest related to any of the items on tonight's special meeting agenda. We'll start at the end with Councilmember Fema.
None.
Councilmember Montano.
None.
Councilmember Dominguez.
Sorry, I just want to note that I am a member of both the Milpitas Rotary Club and the Lions Executive Club. And I know that that is number 3 on the agenda for our special meeting.
Okay, well, I'll look at that and then I'll advise you when we get to that agenda item.
Thank
but
you.
If you're not a board member, you should be fine to participate.
Thank you.
Vice Mayor Nunez.
So I'm a member of both. I am a board member. That wasn't me. I am a board member of both, and that still isn't me. And I have actually donated for this effort to both groups. So Chris, is that okay to still participate for that one?
So let me look at that as we get to that agenda item.
Okay.
But as a board member, the traditional role, and this may not involve a contract, so I'll defer to staff on that. But if it does involve a contract, the usual recommendation for a board member is to recuse yourself from that item.
Okay.
That involves.
So I have a point of clarification. So I'm a chartered member of the Lions Executive Club when it's first formed back in 1998, I believe. But I'm no longer an active member, but a chartered member. Does that count, or just it doesn't matter?
So as a general member of a service organization, under the conflict rules, you can participate. You just want to note it for the record. So your notation tonight as a member is good. As a board member, it may require a recusal. So I'll double check that.
All right.
Okay. Now Mayor Tran.
No.
So let the record reflect just the 3 notations for the members and board members of Rotary and Lions, and that would include Councilmember Montano, who has a historical membership but not active. Councilmember Dominguez, who is a member of both, I believe, and then Vice Mayor Nunez, who's a board member of one or both.
Both.
Okay,
Both.
perfect. And then the second question, I'd ask the mayor and council to please disclose any campaign contributions of 100 or more received within the last 12 months from any party entering into a contract with the city on tonight's agenda. Councilmember Fan?
None.
Councilmember Montano?
No.
Councilmember Dominguez?
None.
Vice Mayor Nunez?
None.
And Mayor Tran?
None.
Let the record reflect none to that question. Thank you.
Thank you very much, Chris. I appreciate that. Moving on here to public forum for this special meeting. I'll check in with Mary here. I want to do 1 minute for public forum. We got a lot of work tonight. Hey, Mary.
Hello, Mayor. There are 4 written comments that were submitted for this meeting. They all are regarding a subject matter that's on your meeting at 7 o'clock. So I'd like to know if you wish for me to go ahead and read those now or to hold off and include them with the comments that come in for that item later on.
Chris, can we put those to the public forum for the 7 p.m. or?
Sorry, Mayor, I was double screening. So I apologize. If there's public comments tonight, so if our city clerk can just repeat what she stated, I apologize.
There are 4 comments submitted for this meeting. That's at 5 p.m. However, the subject matter of each of them regards a subject that's on the agenda for the regular meeting at 7. So I'm just inquiring, shall I go ahead and read those now, or can they be held off until the later meeting?
Mayor, I think if you as a council want to just defer it and because of the topic and what it's related to, which is really your next agenda, I think the council could decide that.
Yeah, I think we should defer it. It will be heard, absolutely, this evening.
Yes.
Okay.
Thank you.
So yeah, I'd like that. If there's any objections, I don't hear any. I appreciate that for the public forum. We'll move on here with the first agenda item. Let's accept the report on COVID-19 testing in Milpitas and approve and authorize the city manager, Steve McHarris, to enter into a formal agreement, memorandum of understanding or other contractual agreement with Hygienics. I hope I said it right. To provide and conduct tests for mobile COVID-19 testing. And we have our battalion chief, Jeff Malone, here with us tonight. Chief, your microphone. Yeah.
Okay. I believe Ashwini is going to start with the first couple of slides, and then I'll describe the actual testing site. So.
Okay, great. Yeah.
Yes. Thank you, Chief Malone. So I'll get started, and I did want to also welcome, we have 2 people from Hygienics here with us, Tom Pascourt and Josna Shah, and they'll be here available for questions if the council has any questions after the presentation. So I'll get started with this. If I could go to the next slide, please. So just a little bit of background. I think we're all very well aware that COVID-19, the pandemic, has resulted in a local shelter-in-place order since March 17th, and it's still effective through the end of this month. And widespread testing is key to community health, ending the shelter-in-place, and also restarting the economy. And unfortunately, testing is still not where it needs to be. So staff has been working with the county on enabling testing in Milpitas. Council has also indicated that this is a really high priority for them. And so as you know, on April 15th, as a result of this, the county testing site opened up in Milpitas. However, testing is limited only to Valley Medical Center patients. And although the ultimate capacity of the site is 40 tests per day, the site is currently quite underutilized. And this is because of the limited eligibility requirements. On April 21st, at the last council meeting, staff presented information and on this site, as well as on testing sites in other cities to council. And at that same meeting, council approved staff recommendations. If we could go to the next slide. So these were staff recommendations which council approved, and it was to continue discussions with the county to facilitate more widespread testing, continue in the interim to support the Milpitas Sports Center site, which is available for drive-through testing, with some limited staffing support, and then to look at really facilitating partnerships with local companies to enable additional testing and to supplement the county lab testing capacity, which is limited. So we're here today to provide you with some additional information on testing and to really discuss a proposal for mobile testing in Milpitas in partnership with IGENIX. And so Battalion Chief Jeff Malone will walk you through the next few slides.
Okay.
Next slide, please.
All right. So what we're proposing is a partnership with IGENIX. A little background on IGENIX is Tom Paskert reached out to me, gosh, it's probably been at least 6 weeks ago now, to discuss the options, stating that they had the capacity in their lab, which is located here in Milpitas, to process 900 tests per day. They had already at that point, I believe, reached out to the county, but hadn't gained any traction, and wanted to know if we could partner up. I've been working a number of angles and trying to figure out how we could utilize our local company to increase the testing capacity in the county. We may finally have come up with a solution. Went up to Fremont to visit their fire department based fixed testing site last week. They shut that down on Friday, and they are transitioning to a mobile concept where they will go out in the community. They will take their testing equipment and their personnel with them. They will set up near vulnerable populations, people who have set appointments, and they will conduct testing basically on site. That'll allow them to focus their efforts on actual residents of the city of Fremont, and then by the same token, we would be able to focus our efforts on Milpitas citizens and our vulnerable populations. We would use the fire department ambulance because it's not in service as a fire department response vehicle yet. It'd be staffed with 3 paramedics or EMTs on a daily basis, Monday through Friday from 8 a.m. to 6 p.m., targeting our vulnerable and at-risk populations in Milpitas. Right now, we're looking to target 100 tests per day. We may be able to ramp that up, but I don't want to be too, I don't want to set the goals too high and then fail to reach them. So we're going to ramp up after we initiate. Next slide, please. So IGENIX's role, and Tom, if you have, if you need to weigh in on any of these things, feel free to. You can raise your hand. So they're going to screen based on the basic public health guidance that we've all heard. People who call in and set the appointments, they will help us with making the appointments. They will provide the test kits and then process the final tests, and then they will bill insurance or seek federal reimbursement for uninsured patients. They will also require individuals receiving the test to sign the waivers and to have an authorized signature on form per state requirements, and that's an MD physician signature. Next slide, please. The city's role is to identify the vulnerable and at-risk populations. That might include our senior housing facilities, our senior housing mobile home parks, the homeless population, healthcare workers that live in the city, first responders that live in the city. Those would be our initial targets. What remains to be done is continue the approval from the county to administer the tests. It requires a scope of practice change for our paramedics to allow them to administer the test, and we're still waiting for that final approval and the protocol. Once we have that, then we will be able to provide the training and schedule our fire department staff, hoping to schedule out at least 2 weeks in advance for people that are off duty, and they'll be coming in on overtime voluntarily. So we'll need to fund that staff time and then administer those tests. Next slide. So, so we continue to work through the county process and the county EOC. We filed an additional paperwork today with our concept with the Fire and Rescue Branch and the County Emergency Operations Center. And then the city, actually, Ashwini, you want to take it from there?
Sure, thank you, Jeff. So yes, we will need to work out some sort of contractual agreement. We'll be working with the city attorney's office to do that, and with IGENIX, which will lay out clearly the roles as well as any other terms. And we also need to internally finalize a policy and procedure that will guide the personnel that will be doing the testing. As Jeff mentioned, we need to finalize the scheduling of the staff and then make sure that all of the staff is trained to administer the test. Next slide, please. In terms of the fiscal impact, as we noted earlier, the city will need to provide upfront funding for staffing costs, which are estimated to be approximately $75,000 through the end of the fiscal year. This is assuming a start on May 18th, and then based on the model that Chief Malone talked about with 3 staff Monday through Friday for 12 hours a day. And these costs will be funded from an appropriated contingency reserve account. We will be seeking reimbursement from FEMA for these costs under the category of a temporary medical facility. Now, as we've shared before with council, FEMA typically reimburses incremental costs such as overtime and additional contract labor costs. So we believe these will be eligible for reimbursement for up to 75% or 90% of the cost. In addition, management costs up to 5% can be reimbursed. If FEMA does not, for some reason, reimburse these costs, then of course the city will need to bear the cost. And we are at this point recommending moving forward with the next steps on the mobile testing. We believe that this is something that will help us address a critical piece of getting back, coming out of shelter in place and getting back to restarting the economy, but most importantly, taking care of community health for Milpitas businesses and residents. And so with that, we're happy to take questions. And again, if the people from IGENIX would like to add anything, or if council has questions for them.
Thank you so much.
Thank you.
Thank you, Assistant City Manager Ashwini Kantak. Thank you so much. Battalion Chief Maloon, thank you so much. I'd like to go to the folks over at IGENIX who are with us tonight. I'd love to hear from you, sir.
Yeah, well, I think first of all, thanks to Chief Maloon. I think he has taken this and run with it and has moved it forward. Our conversations have been centered around how to best help the city and the community and the county emerge from the shutdown that we've all been experiencing. IGENIX has significant experience doing high complex tests for decades. We primarily have been focused on tick-borne diseases. We're a CLIA certified lab. We have been doing COVID testing now for the last several weeks. Our capacity is about 900 tests a day. We have options on additional capacity to double that within about a 2-week time frame. All that we're really waiting for is direction from you guys on how we can best help the city of Milpitas moving forward.
Thank you so much, Tom. Appreciate it. Quite an important agenda item we have tonight here. I just have a couple of curiosities. I do support the item. I do want to say that. So, what other cities are doing the mobile testing? I think it's such a fantastic idea, just so that we can really ensure that our tax dollars are going to serve our Milpitas residents. But it's an interesting concept. I don't think I've caught it in the media. Are there any other cities that are taking this approach?
Yeah, Mr. Mayor. So I went up and met with the fire department in Fremont last Thursday. Again, they're shutting down their fixed testing site, which is located at their training facility. And they are moving to the mobile concept. So they were supposed to have started that yesterday, but they did say that they may experience some hiccups and they weren't sure that they were going to be able to get it off the ground. My intention is to check in with them again on Thursday or Friday of this week and see what lessons they've learned. As far as I know, as far as I'm aware, that is the only city in the area that's doing that. One of the things that drove that decision was not only the cost of the fixed testing site, which was fairly high, but it was also the fact that about 45% of the people that they tested were from Santa Clara County or out of state. And then the remaining people were Alameda County residents, but not necessarily Fremont residents. It was open to everybody. Not that there's anything wrong with that, but for the money they were spending, they wanted to try and focus their efforts on the vulnerable populations in the city of Fremont. And it makes sense to me.
Yeah, absolutely. That does make sense to me too. You know, and when you talk about mobile, I'm thinking wheels, not antennas. What kind of wheels will we be using? I know we got a nice ambulance around town. I'm hoping, which vehicle might we be using?
Probably going to be centered on the ambulance, yes. And they'll take the equipment with them on site, including their personal protective equipment. And that's our intention now. If at some point while we're still running this program, the ambulance actually goes in service as a 911 response vehicle, then it could be transitioned into probably just any old pickup truck.
Oh, tremendous.
For now, we're going to use the ambulance.
Yeah, great. That's music to my ears. Just because I know our city made a decision not too long ago to ensure the public safety of our community. And I'm thankful for the council members that made those hard decisions to make a not so hard decision, which is great. I guess one more question I have is just out of my personal experiences around town. Now, I know if an ambulance pulled into my neighborhood, it would be noticeable if I had requested and was granted a test. Will there be an option also for, and I think it would be great at mobile because there's folks in the community that have transportation challenges. And so mobile is actually really right to your doorstep, right? That's kind of the way things work. But if a member of the community was selected to have the test based on the need, of course, the most needy, will they have an option to maybe cruise over to fire station, one of them out of all of them, to maybe have more of a private test? How will the resident experience be, if you could share maybe what you envision?
Yeah, so the privacy concern is something that we've thought about. I think what would happen is the ambulance would take a tent. So the actual testing procedure would be done in relative privacy. Probably we wouldn't actually set up right in the neighborhood so all your neighbors watch you go to get tested. We would set up adjacent to the neighborhood somewhere. So we would have to form partnerships with places where we'd be able to set up for a day. We would do outreach, community outreach through social media and through homeowners associations and things of that sort. Your concerns are valid, and it may be at some point that one of the places we set up for mobile testing, because we have identified a vulnerable population near the fire station, is we'll set up someplace outside the fire station, but on the fire station grounds.
Excellent. Options are excellent. I appreciate all options at all times when making decisions. Battalion Chief, I appreciate the information. I will now go to the virtual hands I see here. First up on the virtual days, we have Councilmember Carmen Montano.
Thank you, Mayor. Thank you, Mayor Tran. Can you hear me?
Of course, yeah.
Okay. So I have a couple of questions for Jeff. You kind of touched on it when you were answering the mayor's questions, but I wanted more details. I like the mobile concept. However, you're going to be you're moving targets, if you will. So not in a bad sense. It's that people, when they want to get the test done, they say, well, we don't know, because it's not stationary, they don't have a permanent place to go. Whereas if we're moving, people don't know where you're going to be at that day, that week. So you're going to have to do more advertising, in my opinion.
Yes.
And so how are you going to do that? Is it going to be flyers, a bullhorn? No, just kidding. I'm wondering how will you advertise where you're going to be at?
So yeah, definitely on the city website. The various social media accounts, OES, PD, Fire, the general cities websites. Will also make outreach through homeowners associations and let people know a couple of weeks in advance.
So will you be doing one neighborhood at a time?
Yeah, we haven't actually identified exactly where we're going to set up. I have identified where I think some of our vulnerable populations are, just based on anecdotal evidence, what I know of the city and our areas that we should focus on. So, but we'll try and get the word out far in advance so that people will have an opportunity if they know we're going to be nearby. And if they have transportation, even if we're not nearby, they could always come to wherever we're setting up on a particular day.
Yeah, maybe, you know, we have the street cleanup days, and they have a schedule, and we know when that's going to happen, maybe at the park. But there's a lot of seniors that aren't, you know, they don't check, they're not to websites and all that, like probably like me. So flyers are, you know, the old fashioned way. That works really well because, you know, they see it right there and they know where it's at. Just some information there. So that was one of how we let folks know. I like the mobile concept. However, it's like you said, it's more work for you guys in advertising. And you mentioned that that Fremont, it was more expensive when they were at a fixed, because it was a fixed cost. How is that? Can you explain why that was more expensive?
Well, partly it was the setup. It was it was the first time that they had gotten into the business of doing any kind of testing on site. My understanding is it was costing them $275,000 per week to run that fixed site.
Wow, that's a lot of money.
Yeah, they had a lot of rental equipment out there. They had rented or contracted with a security company. They had contracted for mobile showers for their personnel, mobile laundry so that they could wash their clothes when they were done conducting the testing. But evidence has shown them that none of those things were necessary.
Okay.
So it
yeah,
was.
so they were kind of like the guinea pig, if you will. So,
Yeah.
So, and then I have a question for staff. FEMA, what likelihood do you think that FEMA will reimburse our city? Do you think it's, you said maybe 80%, but we don't know yet. So do you think that it would be close to 100%, close to 90%? What is, let me backtrack. Would it be likely or unlikely, or still don't know?
Thank you, Councilmember Montano. So on the FEMA reimbursement, we believe this will qualify as a temporary medical facility, and that's what we would be applying under that category. So typically, FEMA would give us 75% of our costs, since this is all going to be overtime, 75% plus 5% of management costs. But if under certain circumstances, if we make the case for it, FEMA does reimburse up to 90% of the cost plus 5% management fee.
Oh, well, that's good. So let's just hope they pull through. One more question. Well, actually, it's a comment. So I do like that you're going to use the ambulance that we just bought. So that's the great news. And and then one more one more question for eugenics, hygienics, I mean. What are the full benefits of testing? Because someone might get tested and then they're tested negative, meaning that they don't have the virus. However, maybe a couple of days later they get exposed. So what good does it do to get tested when, maybe, is it only good for the people that are negative? And then who's to say that someone tests negative, but 5 days from then they'll contract it? And do do they need to get tested? I mean, then they'll have to get tested again. So it's just kind of like a never ending cycle. So, and because it's, you know, expensive, yeah, I just wanted to know, what are the full benefits of this testing?
I think those are great questions. I think, you know, obviously the first order of benefit is if someone tests positive to a COVID test, you want to extract them from the community so there is an additional community spread. That's where the cost to both people as well as government, as well as companies, just multiplies exponentially. So the first thing that I think all of us want to do is, if we have someone who is positive, extract them from the community, isolate them, don't let them have community spread. But I think the question about how this plays out over time is a good question. I don't think there are any known answers right now. It may be that this is a process that continues for months or quarters or years until we have a vaccine. But I think first and foremost, if someone is positive for COVID, you want to extract them from the community. Don't let them be infectious to others.
Yeah, I know that right now, that's what I heard, that we're supposed to pretend like we all have it and do social distancing, wear face covering. So it's kind of the same as what you're saying. So anyway, just food for thought. Thank you.
Thank you very much, Councilmember Montano. Appreciate you. All right, looking here on the panelist list for any virtual hands. It'll be a tremendous night of public service. I request kindly for folks to really emphasize the hand, and I will call on you down the list. Next up, we have Vice Mayor Nunez.
Yes, thank you. So I'm glad that most of my questions have been answered. So I just have I think just a few more. You said that we're still waiting though for the county to approve something. Is that, did I hear that right?
Yes, sir. Our paramedics in the county right now are not authorized in our scope of practice, which is the protocols that we work under to administer the nasal swab tests. It has been, that expanded scope of practice has been approved at the state level. And we're working with our medical director, EMS medical director, Dr. Ken Miller, to finalize that protocol for Santa Clara County paramedics to be able to administer those nasal swab tests.
So is that why we're waiting till the 18th? Do you think that's when we'll be approved?
I'm hoping we get approved before then, because then we have to train our people. And then we have to start our advertising and target our people and make our appointments. And so that actually may be a little bit ambitious, but I would really like to start something by that date.
Okay. I was just going over the numbers in my head again. Do you think it's going to be about $75,000 between now and, it was at the end of June?
Yeah,
and that we would
correct.
recover most of it. Okay, and we would recover most of that from FEMA. Somehow I'm struggling with that $275,000 a week that was being paid by Fremont. Those numbers are just so far apart. So can you explain to me, are we that much better? I'll take that as an answer, by the way.
No, they were new to the game. The way they structured it, a lot of that is their overtime cost. In addition, the lab they were using was charging them for the tests. So they were paying $135 per test for every test that they administered. That was a substantial cost for them at 130 tests a day. In addition to that, the way they structured their personnel is they put them on a 14-day rotation, 24 hours of overtime for 14 firefighters and paramedics every single day, and then the backfill for the people that they had pulled offline. So every day they were backfilling, you can assume at least a third of those people with overtime. So that was averaging probably 18 to 20 people per day on overtime. That was their biggest cost. And then they had rental facilities as well. So.
Okay. Then my last question is, you said that IGeneX, you're capable of doing 900 a day. Is that correct?
Yeah, our present capacity is 900 a day. We have been limited by reagent and swabs. We now have all of those. We also have the capacity to double production with about 2 weeks advance notice. We've been working with our suppliers and machine vendors. We've had very, very significant interest from a lot of private companies. I think that before we're done, we're going to be doing more tests rather than fewer tests.
So what is our goal? Or do we have a goal?
Right now, it's 100 tests per day. That's based on our personnel limitations. If we're successful and as we get more practiced, we're able to ramp up that capacity, I'm absolutely happy to do so.
But it's well within the limitations or that 900 that they currently have available, correct?
Yeah.
Okay. So, because I didn't want to hear they have a $900 number cap, but they're currently doing 850. So there's really only 50 in that space. But if there's enough in there to fit our 100, this makes a lot of sense, and I'm very supportive too. So I'm thankful that it's something that we have found, and I think it's important for us to do all we can. I think it's right now it's important to make the community feel safer. That wasn't me either. I'm going to say that every time I hear a noise, just in case it is me. I am hopeful that relatively soon our ambulance is online someplace here. Hopefully we have something better than a pickup truck to put you in. I think it is something that as soon as we can start it, that we do. So I am going to be supportive. Thank you.
Thank you.
Thank you very much, Vice Mayor Nunez. Next up, we have Councilmember Fan.
Yes, hello. So a couple of questions. Firstly, as it pertains to, I guess, liability. Chris, when it comes to this vendor conducting the tests, anything is for whatever reason inaccurate or goes in an unexpected direction, who's at liability?
That's a great question, Councilmember Fan. It's still open. At this point, we don't have a contractual arrangement with IGenX, and so that would be something for us to work on, I think, if council does authorize us to proceed tonight. But the liability concerns would be something we'd have to talk about. Our traditional consulting agreements, our traditional public construction agreements, essentially put all the liability on the consultant or contractor.
Sure, thank you. I think it's just a question that I usually ask of vendors, no matter what service they're trying to provide to the city, just out of best practice. But so I hope the representatives don't take that question the wrong way. If I can speak to the representatives, Tom, Dr. Shaw, thank you for being here with us and offering this service. Maybe you can walk me over the history of your company. It's based in Milpitas, is that correct?
Yeah, so the company was founded actually in 1991 and has been in business since then, doing primarily high complex tests for Lyme and other types of tick-borne diseases. We process right around 250,000 tests each year annually. When the COVID issue arose, because we are a CLIA certified complex testing lab, knew that we could provide the service and quickly ramped up and have been performing these tests, as I mentioned, for the prior 3 weeks or so.
Where are you based?
We're in Milpitas. We are off Gibraltar, right next to Flax.
Wonderful. No, it's great that you're doing this work. And so outside of COVID-19, you mentioned that you do testing for diseases like Lyme disease. Are there any other services that you provide, just for my own knowledge, the kind of research that you do?
Our core competence is primarily Lyme and tick-borne diseases. Lyme is one of those diseases that is very, very misunderstood, and is often misdiagnosed and creates just tremendous difficulties for those who aren't properly treated. It's a very, very complex disease. Testing is not the easiest of things to do. And I think that that technologists here do a very, very good job putting out just superior, very high quality tests.
Wonderful. I'm taking a look at the COVID-19 tests that you offer. So the test that is being presented to the council, which one is that? Is that the C100, the C400, or the COV1? And what's the differences between those?
It would be the C100. IGeneX offers a variety of tests. C100 is the COVID test. The other tests are antibody tests.
I see.
We test for both an M antibody, which is an antibody that is produced shortly after the disease goes into remission. Over a period of time, the M then transitions to the G antibody. We test for those as well. So we hear an awful lot about antibody testing. We do those, but I think what we're talking to Chief Malone about is specifically the COVID testing for the RNA test for those who may have current active infections.
For the antibody tests, I don't know if you know, or if anybody amongst our staff can step in if they know the answer, but our antibody tests, would that be covered for reimbursement as well, or have you heard anything?
So right now, the way the process works is COVID is covered by Medicare at a level that makes it financially viable for us to offer coverage for insurance. The insurance carriers who we reached out to will be covering reimbursement at Medicare rates. The antibody tests, they have not established a Medicare rate yet. So we don't know if it's reimbursable or at some point in the future what that reimbursement rate would be.
Okay. Well, if you do find out in the future, and if the answer is that it is reimbursable, please bring that to our attention. I think that's a topic that's worth exploring. I know we're talking about the COVID test, but that finding those antibodies there, I'm sure will go a long way towards combating this. And it seems like this can have a lot of potential. This relationship between the city and IGeneX, I'd like to build upon that. Here in Milpitas, we'd like to do business long term. So, in terms of the testing itself, I see numbers that you refer to as the sensitivity percentage. I think this is just for maybe the antibodies, but can you clarify what that number means?
Which one are you looking at?
I'm looking at the C400 and the COV1 tests. it says, for example, for C400 sensitivity is 90.9%. What's meant by that?
So basically, we did a small study because it's not easy to get positive samples. So we looked at real-time PCR positive patient samples, took blood samples from them, and tested them for IgM and IgG antibodies. And in the group we looked at very limited, we saw the sensitivity of IgG in that particular group was 90.9%, for IgM was 63.3%. But it's a very small size. We've got better data. We are working on it. I just wanted to give an idea what we are finding, that if you hear in the literature or from people, everybody is saying just do IgG test, because that's when people are cured. But what we are finding is that if you're following the disease, you would want to, say somebody is positive by PCR. This is an example. That person later on becomes negative by PCR, but we'll start making antibodies, and everybody makes antibodies at different levels. One person might start having better antibodies in 5 days, others may take 30 days before they convert to G. So this helps you to monitor the progression of the disease, and when the person is really safe to go back to work. Right? We arbitrate that if the person is PCR negative, they can go back to work. But that may not be true if they are still actively infected. Based on other diseases that we have followed, we have found live parasites, for example, in blood samples when the patient has IgM antibodies. As soon as they start making IgG bodies, when they are high level, they're still there. As the disease is resolving and it's IgG, you find that the parasite disappears, meaning the virus should disappear, but we don't have that kind of data for the virus. Because the test that we have right now, we are looking at it early disease and when they clear out. These are unknowns that we have for the COVID. Based on our experience with other diseases and what little we have seen with the antibody test, we believe that it's important to do the M and G to follow up patients. Then you know exactly at what stage the patient is. Has the patient been infected? Has the patient never been infected? If the patient has been infected, are they having enough IgG antibodies that they are immune? We can get all the answers. This is really the full stage of the disease if you follow antibody and PCR.
But from a practical, what that kind of means is, let's suppose there's 1,000 folks in the population you're testing and 5% of those are positive. Our test would pick up 954 negative, and they would show 46 positives. All the positives would be picked up. We would have 4 false negatives. So it's a very, very small percentage. And if you're going to have a false negative, you want it to be on the negative, not the positive. So it's a very, very good quality test. And there are online calculators. You can plug those numbers in yourself. But from a practical perspective, that's really what it means in terms of a broad population that you're testing.
That's because the specificity of the test is high.
It's very high.
And we know the sensitivity is very good because we're looking at multiple antigens. It's a system that we have developed here where you can, in fact, we can see what comes up during early stage disease and what comes up later in the disease. We see the changes in the antigen antibody expression as well.
Yeah, and it's a fantastic question. There are some companies out there to hear so much anymore about very, very poor quality antibody tests. Their specificity and sensitivity is so low, it just doesn't even make sense to do.
So one of the issues that we have with the antibody tests which are out there, there is very limited information on the sensitivity of the test. Everybody talks about specificity. Now in real world situation, you really need to have a balance between sensitivity and specificity. You can increase your specificity as much as you want. And by doing that, you can reduce the sensitivity to practically very low levels. And vice versa, if you increase your sensitivity too high, you can have a test which is 100% sensitive, but your specificity can be low. So there is a balance, and you want to come up with that test that will give you good sensitivity and good specificity. And that's what we have done.
So the Cogut test, how many times would you administer that, or what methods, if there are any? And this is referring to the COVID one, not the antibody one now. What methods are you using to mitigate or reduce the false negatives? Or
at this point, we have no answer on that. Well, what we don't know the answer. We haven't done enough testing ourselves to answer that question. But based on what we have heard from other, from our physicians that we work with, I've heard of cases where patients have really been sick and the tests have come back negative. When we have looked at antibodies, they are strongly positive for M. So that tells us that there are patients who are being missed.
I think specifically to your question, the test protocol, when we perform a test, we do it on a plate, and the plate has 96 wells. We do 96 tests. We reserve 6 of those for 3 known positives and 3 known negatives. If we run the test and those negatives don't show negative, or the positive doesn't show negative, we invalidate it and redo everything.
So basically, every run would have control to your answer in terms of how many would you in the real world situation. We don't have an answer.
Okay. City Manager, do you concur? I'm just teasing.
Okay, well, I do not dispute the doctor's.
These all business.
I'm going with the doctor on this one.
Yeah, no, that's probably a good idea. Thank you for your answers. I think that pretty much covers all of it. Just one last one. In terms of the actual testing, the methodology itself, and is that any? How does that differ from that of the counties? Is the main distinction your capacity? Do you have just greater capacity, or is there, anything else that you're doing that's makes this unique?
No, we are just using UAF test, and we are using Thermo Fisher, and we have also validated from test that it's under investigation right now by FDA. It's being reviewed by them. So we validate 2 tests, which have high throughput, the way we work here. And those, in terms of sensitivity, both of them look very good. If you look at the PCR, the sensitivity is very good in terms of copy numbers we can see of the virus. It falls around 10 copies. And when we calculated as to how many copies per mil of sample, it comes to around 2,500 viruses per mil of sample. That is what our calculations showed us. This was fairly well done because this was being submitted to FDA. The studies have been extremely well done. So that's where that's the number I have in terms of sensitivity of a clinical sample. If there are 2,500 copies per mil, we should be able to detect it. Below that, we don't know. So that is, if the load of the virus is very low in that sample, we could miss it.
Okay.
I think that's the reality.
Everyone is using pretty much the same standard reagents and everything. There are some process tricks and some process black magic that I think IGeneX folks, because of their almost 3 decades of experience with complex tests, are able to overcome. For antibody tests, we use a completely different mechanism. We use immunoblots, which is self-developed here. We have a lot of experience. It's a very, very, very far more sensitive test for antibodies.
Very specific as well, very, very specific.
Very specific. It's just a phenomenal test. We hear so much about poor antibody tests. Ours, based on immunoblots, we've done, I don't know, maybe about 150, 160,000 tests last year. Using this platform is very well known, it's well characterized. We're very, very comfortable with that type of a platform. Others, who knows?
It's all in-house. We control it from beginning to end. Our sister company makes the blots for us, and they're real experts on it. The test that we are using, probably one of the tests is we are the only ones in the world offering that test now. And it's been approved by New York State, California. It's very well accepted.
And we have antibody tests from other providers that are just wrong based upon known sample results we have inside. They, some just don't work very well.
I see. Well, this has been very informative. Thanks, Tom. Thank you, Dr. Shah. I feel very good about this partnership. I hope, to hear, further updates from our staff. Thanks, Chief Maloon, Ashwini, Steve, all your work on these efforts, and keep up the good work, guys. Thanks.
Thank you very much, Council Member Fan. I do want to ask a follow-up question for our IGenX team, proudly calling Milpitas home. What's the turnaround time for these tests from when the sample is obtained?
Our turnaround is very, very quick. The sample size we're looking at is one run. We start each run in the morning at 6. The first run takes about 3.5 hours. Every subsequent run takes 1.5 hours. We process 90 tests a run. As soon as the run is done, all the positive and negatives are entered into our system. Once that is entered, within 5 minutes, we can generate a system output in an Excel format, showing all the tests that were run, all the demographics, patient and doctor, who's positive, who's negative. We can get results out very, very quickly. And, Battalion Chief and I have been talking about how you can have a phenomenal, a great test, but if you're shipping kits all over the country and all over the world, and it takes 4 or 5 or 6 days for this type of a test, it's almost useless. And that's why this type of a partnership between a business and a community, where we can generate a very, very quick turnaround and very, very quick presentation of results is just phenomenally important.
Phenomenal, absolutely. So these tests won't be needing to get shipped anywhere. It's all right here in Milpitas.
Absolutely.
Yes. Thank you so much. That is phenomenal. Next up here, we have Council Member Carmen Montano.
Thank you, Mayor Tran. So a question for Jeff. Jeff, is you mentioned Dr. Ken Miller. Is he still around? I mean, he's been your doctor for the fire department's doctor for many years. Is that the same one that was there like 50 years ago?
No, actually, no. Ken Miller is the county EMS medical director. He doesn't work directly with the Milpitas Fire Department. We contract with Stanford for our physician advisors.
Oh, good. Okay, thank you. And then Ashwini, so I wanted to find out what's the time frame for this 75,000 for service?
You're muted, Ashwini. It takes us through
unless you know.
June 30th.
Hi.
Oh, there she is.
Okay, thank you. Thank you, Jeff.
Sorry, so Councilmember Montano, was your question about how long will it get to reimburse?
No, the time frame of services from, you said
May
to when?
May 18th, assuming a start of May 18th through June 30th.
To June 30th, and that's for the 75K.
Yes.
Right, okay, and so there's no other cost, that's the 75K, right?
That's right. That's our estimate. Yeah.
Okay, so but I'm still a little bit confused. Do the patients, the people still have to pay, or is this part of the payment that the city's paying?
Yes, so the model that we're proposing, council member, is that the city would only have to pay for staff costs, so the overtime costs that we talked about. And then IGenX is actually going to either bill the patients directly if they belong to certain insurance companies or Medicare, or if they're uninsured, they will seek reimbursement from Health and Human Services, federal reimbursement. So okay, IGenX is, proposed a good partnership on this front, which Fremont didn't have.
Okay, so they will bill, so IGenX will bill the patients that more than likely don't have insurance. For example, if I have Kaiser, so, and I know Kaiser, you have to, you can get tested, but you have to make an appointment, I believe. But IGenics will provide the services to anybody, or
Yeah,
actually to those that are not insured, right?
Let me clarify.
Or to those that are insured as well, but certain insurance companies. So Kaiser actually would not be included because Kaiser basically mandates that
Yeah, they
their
have to-
members get tested through Kaiser.
Okay.
But yes, other like Aetna or other insurance companies, they can be billed directly. They can come to IGenics, and the IGenics will handle the screening and making appointments and the billing piece.
And can I ask how much they will charge a patient?
Yeah, let me clarify. So the model that we've been discussing with Chief Balloon is that IGenics will accept insurance assignment for a variety of insurance companies. And what that basically means is someone will sign up on our website for a test, and they will provide, when they drive up for the test, an insurance assignment form, which basically means we charge them nothing. We will accept insurance assignment and we will go to their insurance company for reimbursement, which is in almost all cases going to be the Medicare reimbursement rate. So a Milpitas citizen will sign up for the test. They complete the test requisition form. If they have insurance with one of the authorized insurance companies, we will bill the insurance company on their behalf and collect those funds, which are Medicare rates. If they are a staff model HMO, which is a type of HMO that has their own facilities, such as a Kaiser, we can't accept insurance for them because Kaiser requires all tests be done in-house. For someone who is a US citizen or a permanent resident and can provide a social security number or driver's license, if they don't have insurance, we will bill HHS out of the HHS Emergency COVID Relief Fund, and we will collect, again, Medicare rate for those folks as well.
Okay. Well, that clears up a lot. So, so more or less, how much do you charge for your testing to patients, or is that confidential?
So our list price for a COVID test is $135. These patients who are contemplated going through the Milpitas process, if they have insurance, would be charged nothing. We would accept insurance assignment that would pay us Medicare rates, which are right around $100 for the test.
Okay. I like your same day results. That's people want to know instantaneously, which is really good. And I trust that the integrity with what I've been hearing so far, I trust the integrity of your company and that you can provide quality testing to our residents that need it. Oh, and one more thing. Let's say someone doesn't know that they, like for example, Kaiser will not allow anyone else to test them but their own clients. So are you going to tell folks, do you have a list of plans, health plans that are not, that they have to go through their own? Will you alert those people that drive up and want to get tested, and when you ask them what insurance do they have, will you let them know right away that they're not they can't? Do you have a list or something that to let people know?
Yeah, so what will happen is anyone who requires a test would go onto the website and they would select COVID. They would schedule a time and a date. They would then be presented with a list of insurance companies who we will accept assignment for. And they can also provide an attestation that if they are uninsured, that we can then use to go back to HHS and on their behalf bill HHS out of their fund. Everyone will know up front when they download the form whether they are covered by insurance, whether they have no insurance, or whether we are unable to process for them through an insurance assignment or an HHS billing.
So if here's a hypothetically, if someone comes in and they have no insurance because they got laid off or they lost their job, will they still be able to be tested at Hygienics, or do they need to go to the county only? County
No,
hospital clinic?
we would test them. If on our form, they would just have to attest that they are uninsured. If they're uninsured, we will test them, and we will then bill HHS and collect the Medicare rates out of HHS emergency fund, and they're still covered. They still get the test. Everything is fine and dandy from that perspective.
Well, that's great. That's what I wanted to hear. And it's, I'm going to, my personal opinion, I like your company, what you told me, and I think you would be a good contractual partner. Thank you. Thank you so much, Doctor.
Thank you very much, Councilmember Montano. Appreciate you. Next up here, we got Councilmember Dominguez.
Thank you very much. I actually have a quick question for IT. Is IT around real quick?
Yeah, go ahead, Councilman.
Just wondering, if I push the participant button on top, could I see my hand raised? Is that the right order that the mayor also sees it in?
Yeah, when you raise your hand, the
Oh,
order will
perfect.
go.
I didn't know that existed. That's great. I could see who's next in line then. Perfect. All right. So I have another, thank you so much for all the information. I think it's great information for all of us as we deal with this pandemic. And so I'm really excited about this. Thank you, staff, each one of you, for bringing this up. It's great. It's great to have it in Milpitas, and it's great to, I like what I'm hearing from this company. And so I have a question in regards of the mobile site itself. And so it sounds like the information is going to be based in on our website and so forth. So I definitely echo some of the sentiments that Councilmember Montano said regarding the flyering, to ensure that we're touching all of the members in our community. And sometimes the accessibility between Facebook and what we post online doesn't get to a certain population. The population that I have a question about would be our unhoused population. So would this be an opportunity for maybe going into some of the hotspots that we already know are in Milpitas that have an unhoused population and offer the testing? Because as we all know, it's harder for them to call and do an appointment, and they don't have access to flyers because of their own mobility. But we know where, they live. I mean, many of us, I know that our police department, you guys are amazing in keeping that partnership with our unhoused population. So I'm just wondering if we would be able to dedicate either a time or a day to go to our unhoused population places of living and get them tested without maybe going through a plot. I don't know what that would look like. So I guess my question would be, is that something that we would be able to accommodate for this particular population that's in here in Milpitas?
Yeah, that was already on our radar. And that's definitely going to be one of our targeted populations. And we'll figure out the logistics with Hygienics regarding how we can go about testing them and having Hygienics get reimbursed.
Perfect. Thank you so much. I really do thank both of you for having this population on the forefront and for including them. And if you could just keep us posted on that, I would just be a little interested to see how that process goes, just to learn from the experience. And also just in terms from a safety perspective, right? If there is any additional safety steps that we need to take, please let us know as well, because I know we would love to support you on that. Thank you.
Thank you.
Those are all my questions. Thank you.
Thank you very much, Councilmember Dominguez. Next up, we have Vice Mayor Bob Nunez.
Thank you. And so at the end of this, I'm going to make a motion so we can move through it. Only knowing that we have two more items. We've already passed one, so I'm going to ask for direction here at the end. But the councilperson brings up a good point. I knew we were talking about the contract. I didn't know we were talking about placement of the actual function and who was going to manage it. I did not and I'm not ready to say it belongs with fire. So if we're going to talk about that, I'd like that agendized again. The contract I'm fine with. I think there's at least 2 other departments that makes a lot of sense to me that it could belong there too. But I'm looking at the hour and all we have to do tonight. I think everything they presented tonight makes sense, and so I'd like to get that issue placed and out of the way. But I would like to have a discussion at another time about how this fits into the overall plan, what department you saw it in, city manager, and how it would fit into that department's scheme going forward. It very well maybe that you thought it was going to be in fire, but I want to hear in its totality how this fits into whatever department it's going to be. But at this point, I'd like to move the acceptance of the report on COVID-19 testing in Milpitas and approve the authorize the city manager to enter into a formal agreement, MOU or other contractual agreement with IGENIX to provide and conduct tests for mobile the COVID-19 testing for Milpitas business and residents in a form approved by the city attorney.
Second.
We have a motion by Vice Mayor Bob Nunez. We have a second by Councilmember Karina Dominguez. All in favor? Aye.
Aye.
A virtual roll call. Here we go. Councilmember Fan.
Aye.
Councilmember Montano.
Aye.
Councilmember Dominguez.
Aye.
Vice Mayor Bob Nunez.
Aye.
And myself, it's an aye. The motion is carried. And thank you to our fine folks from IGENIX. I'm delighted that you've decided to call Milpitas home, hearing the number of tests that your business has provided across all public health concerns is very much something I'm delighted with, seeing that there are sales taxes with your product. And there's nothing I like more than to encourage our city staff, our PIO, and IGENIX to come together to really display what our council has directed, which is to provide a very necessary service as a city. This partnership is extremely valuable to our residents, and I hope to see IGENIX put in the brightest lights during this time to show that every single Milpitas resident household that we are Milpitas. And so thank you so much. All righty, here, moving on to the next agenda item. Let's receive a staff report and provide direction on the 2020 4th of July Independence Day fireworks display and virtual event. And I will look to our Director of Recreation Services, Staff Director Extraordinaire, Renee.
Thank you, Mayor, and good evening, City Council members. So we'll jump right in. Tonight, you're going to be receiving a staff report and provide direction on the 2020 4th of July fireworks display and virtual event. So the City of Milpitas annually celebrates the 4th of July at its signature special event. This event attracts more than 12,000 people at the Sports Center complex each year. Attendees enjoy a pool party, evening concert, children's play area, food trucks, DJ, and a professional fireworks show at the event. Due to the current COVID-19 pandemic, Santa Clara County public health restrictions are prohibiting large events and gatherings that preclude the likelihood of us being able to hold our traditional festivities. On April 21st, City Council requested staff return with information related to the 4th of July fireworks contract, including costs for 4th of July fireworks display with no public event or public gathering involved. You also directed staff to include other options for celebrating the day, any county guidance received, and any status plans for fireworks shows from other nearby cities. Next slide, please. So the City of Milpitas is in contract with Fireworks and Stage FX America for the annual 4th of July event and Lunar New Year event. For the 4th of July event, the contractor provides a synchronized sky concert for our fireworks show. Per the contract that exists now, if the display needs to be canceled, the parties can negotiate a new display date within 120 days of the original display date, which would mean before November 4th. After receiving a determination from our city attorney's office and receiving a letter from Fireworks and Stage America with additional options outside of the existing contract, the city has 4 potential options for the 4th of July 2020 fireworks display. Next slide, Mike. So option 1 is hold a fireworks display on the 4th of July per the terms of the contract. Number 2 is tentatively plan to hold a 4th of July 2020 fireworks display. And should the city need or decide to cancel, we could notify Fireworks and Stage America by June 22nd and apply monies for deposit towards next year's 4th of July show. Third option is reschedule the fireworks show now to another date to occur on or before Labor Day 2021 with a requested 60-day notice before the new event date to the contractor. Or cancel the fireworks display and notify Fireworks and Stage America by May 8th with no penalties. Next slide. For options 1 through 3, a deposit is required, which is already a compensation requirement in our existing contract. But per Fireworks and Stage America, they are aware that municipalities, just like ours, are responsible for unplanned emergency costs related to COVID-19. And so reducing their deposit, which is typically 50% of the show cost, to 25%. So if council determined to move forward with option 1, 2, or 3, $5,750 would be due to our contractor on May 15th. And to reiterate, if the city decides to reschedule either 4th of July 2020, if we decide to reschedule to either 4th of July 2021 or on another date before Labor Day of next year, we need to let the contractor know by June 22nd. Next slide. So the staff contacted the County of Santa Clara Executive's office after receiving notice that their annual fireworks grant program was on hold indefinitely. This program, which is an annual program, is currently being deferred until they receive further guidance regarding the shelter-in-place orders from public health. The county did advise city staff in an email on April 23rd that they have not put forward any guidance regarding fireworks displays in the county due to the uncertainty of where we will be with COVID-19 mitigation efforts during and leading up to July. Next slide. So staff is proposing several virtual activities to celebrate 4th of July. The activities will be marketed through social media, print advertising, signage, and community partnerships, and a week-long United Spirit of Milpitas, Spirit of America virtual event. Residents could participate in fun, simple, and collective activities and show their community spirit and patriotism. It could kick off the week with activities where residents are invited to decorate their homes with flags, with yards or balcony signs announcing their household's participation. Some components of the virtual events would be public decoration of City Hall, such as red, white, and blue bunting and large flags, use of our electronic billboards for messaging and fireworks graphics, virtual community center 4th of July activities, such as holiday games, crafts, and recipes, an online gallery of patriotic home decor where residents could share pictures on social media, including similar window, balcony, or yard signs via free downloadable templates from Recreation Services. And a 4th of July Spirit of Milpitas slideshow where residents are invited to submit photos for a festive slideshow of Milpitas 4th holidays from now through the past and history, set to music and posted online, social media, live stream, and broadcasted on our Milpitas cable channel 15. And finally, a Spirit of Giving blood drive, food drive, and backpack supply drive, where community groups would be invited to host or coordinate with the city on drives where residents can support their neighbors to overcome the outlying effects of coronavirus on our community. Next slide. So what are the costs? So this slide details the costs to hold a fireworks display with no public gathering. So we'll go down the list for staffing, which includes our fire, Police Department, Public Works, and Rec Departments. It's approximately $24,790 for 4th of July fireworks display with no public gathering. The contract for the display is $23,000. A fencing contract to go around Cardoza Park and the Sports Center entrances is about $10,000. And we anticipate marketing at about $750 to let people know about the live streamed display, but also to stay away from the area and that no gathering is allowed or encouraged. If you go down the other events, that is the virtual events. So staffing for that is at $750. That's recreation staff decorating our city hall. Supplies and decorations that are about $3,000, and that would be more heavily marketed at about $1,200. So the subtotal for fireworks display is $58,540. The subtotal for the virtual events is $4,950, and for a total of $63,490. Next slide. So to sum up the costs for the various 4th of July event scenarios, if there is no show and no virtual event, the cost is $0 to the city. If the city does a virtual 4th of July event only, it's $4,950. If they decided to do, or we decided to do, a fireworks show only with no public gathering, it's $8,540. If we do everything, it's $63,490. Next slide, please. So there are approximately 12 immediate Bay Area cities that hold 4th of July fireworks shows. And those shows are provided by cities. Some are county fairs or at major event venues like Great America or Shoreline. Berkeley, Cupertino, Mountain View, Redwood City, San Jose at the Almaden Valley site, and Santa Clara have announced, some as recently as this morning, that they have completely canceled their fireworks show. We are still waiting to hear back from the cities of Campbell, Gilroy, Pleasanton, and the San Jose Meadow Park location. They've not confirmed either way. Cities that have completely canceled their fireworks events have done so due to fiscal constraints, but also as major concerns about potential for people gathering in areas around shot-off displays, regardless of messaging and signage about the dangers of doing so and what that might mean for county efforts in mitigating coronavirus. Next slide. So for fiscal impact, Recreation Community Services is budgeted in their 1920 fiscal year budget for the 4th of July event. In contracts, we have about $71,000, and in supplies, we have about $10,000 for this event. Staff costs for the day are approximately $57,000 and are allocated in each respective department's annual budget. The total approximate costs for traditional 4th of July event is $138,000. The $138,000 is also included in the fiscal year 2021 proposed budget. Next slide. So depending on council direction tonight on our event options, there could be an approximate cost savings for the city ranging from $74,510 to $138,000. Any cost savings tonight would be allocated to the budget stabilization reserve to offset further potential revenue losses in the general fund. Next slide. So to conclude the presentation, the recommendation tonight is to receive the staff report and provide direction on the 2020 4th of July fireworks display and virtual event.
Thank you so much, Renee. I appreciate and thank you for the very well informative presentation. Much of the slides were displaying information that I was most curious to know. I want to thank the Vice Mayor and the City Council for making the effort to uphold one of our great traditions here in town. But we are one town among many here in this valley and this county. And one of the slides clearly showed, displays is a good word to use for this item, but one of the slides really displayed what other towns are doing. And the trend is doing the right thing, which is the cancellation of the firework displays seeing our neighbors in Santa Clara, Mountain View, Cupertino, Almaden Valley, which I was there not too long ago hiking, but I've seen new information tonight that leads me to, as one person, to really hard for me. You know, I've relied on the 4th of July fireworks since I was a youngster here in town, and but the right thing to do is to go a different way and not do the display, but go a different way and celebrate through those other options. I will think kind of more reasonably as well to say that if we're one of the few towns with fireworks here in this valley, and folks in the greater area had that information, I'll tell you, there'd be a lot of people coming to Milpitas. There's already a lot of people coming here as it is, because we do have under the great Recreation Service Department one of the best 4th of July displays. Thank you, Renee. I know months and months ago, before all this, I met with the Vice Mayor, Bob Nunez, and we had some really patriotic ideas to add to our Independence Day here in America, where we celebrate our freedom. I think we spoke about, you know, the potential of Vice Mayor. I see him, yeah, but you know, we talked about having a Ferris wheel back in Milpitas, like we had at the Frontier Days, right, Carmen? Yeah, Councilmember Montano. I got that idea from you, like many ideas I get from you, Councilmember Montano. Thank you so much. You know, even a little parade, a good one, but a little one, but a public gathering is not, as we go day in and day out with the COVID-19 here in America, it's not the right thing. The virus is still out there, not any weaker at all. Not any weaker at all. It's just, and to just go over agenda item 1 and then go to agenda item 2, you know, we're provided even more information from our great staff. And so I, at this time, will take a position to not have the fireworks display, but to also explore other things. I think the main thing for me is another one of Councilmember Montano's great ideas is the flags. I remember everything Councilmember Montano said. She said the flags on Calaveras. I'm sure we could partner with the state leaders, Caltrans state leaders, to even you know, have greater support, make our lives easier here in town. And I would love to see City Hall red, white, and blue all of July, not even just the week or the day, but we'll see. Not entirely up to me. But I remember when the Super Bowl came around to Santa Clara not too long ago, I think they had City Hall a different color. And so that's my recommendation for the council to decide. But thank you, everybody. I know that this was an idea I kept trying to push for, but I thank everybody for their time on this, city staff as well, Renee and Vice Mayor of the council. Thank you for putting up with this one. Hey, it's working out like how we said. Let's get more information and take it day by day together. So thank you so much. Okay, next virtual hand I see Vice Mayor Bob Nunez. Your microphone, sir. Yes. yeah.
I sounded really good over here. First, I agree, Renee, that taking the time to put all this together for us, we really appreciate. And going out and visiting and talking to all those other cities, finding out what they were doing. I think there was not a firefighter that didn't let me know one way or the other that whatever you do, don't let us be the only city that did this, because everybody in the world would then be here. Some said it very nicely, some just said it very loudly, but they said it. So I agree, Mayor, that what we want to do is just honor the day in another way. And I think you included almost everything that I had heard, Renee, in the things that you shared on your charts. The two things that I just want to include in there, make sure we include in there. One, oddly enough, came from our city manager and from Tom Valore. And that is, if we could somehow get, let's see, I want to make sure I get it right. The Blue Angels, they thought you could do this, Mayor, or the
I'm working on
Thunderbirds
it.
to fly over this city. That would be patriotic for us. See, I knew you remember, Steve. I wasn't going to let it go. And then one of the things that I have found is, the years that I've been involved with the service clubs here, we've all done our own thing, and of late we have all pulled together. So I think the putting out of the flags is something that Lions has always done, at Veterans Day. And now they'd like to, if we're going to do that on 4th of July, they'd like to be part of that too. They want to be the ones putting them out wherever we want them to. We at Kiwanis always do backpacks, when school starts. And now that Kohl's still is closed, and we think it still might be closed, and we won't be able to do what we normally do to start the school year. When we saw backpacks on there, we like to be part of that process or that giveaway, and we have backpacks that we could share, and if we're going to do a giveaway, do that. Rotary is also wanting to be part of this. So I think what you're seeing is, if it's going to be different, make it a good difference that shows that this city knows how to pull together when times are tough. And every service club that I'm aware of wants to be part of it. So if you can include them in there, Renee, they're willing to do anything within their power. If you look at the face mask, even Carmen is out there making face masks. And so I think everybody wants to be helpful. And so I think we can do this and make it just as great a day, just a different great day. So, but Renee, it takes somebody to pull it together. And all of us think we're doing it, but actually we know you're doing it. So thank you very much.
Thank you very much, Vice Mayor Bob Nunez. Next up, we have Councilmember Carmen Montano.
Thank you, Mayor Tran. Remember that song, Ain't Too Proud to Beg? Remember that?
Oh.
I was begging you, please, no fireworks. So thank you so much for seeing the light. And that would have really been a nightmare. So,
right.
But I understand your patriotism, and but just sometimes we just have to sacrifice. And yeah, I just want to thank you for doing the right thing for everybody, because we're trying to keep our citizens safe. Also, if you can add, as the Renee on that list, flags alongside Calaveras, I think that would be great. We can bring that back again. And also, I like your idea, Mayor, about lighting up City Hall. You know how I think San Francisco, they light up their whole City Hall, or I think maybe Oakland does too. Maybe I think that would be awesome if you could do that. And if you can get the Blue Angels, maybe it could be a county or maybe a tri-county effort. That would be awesome.
Don't forget about that the big old flag the fire department has on the tiller truck. If we can put that on the list.
That's right. That's awesome. Yeah, I love that. Yeah, that'd be cool. All right, thank you so much, Mayor. Okay.
You're welcome. Thank you. All right. Next up here we have Councilmember Dominguez.
Thank you so much, Mayor, for the time, and I cannot echo Councilmember Montano's relief that I feel right now. And on behalf of the safety of Milpitas, I thank you, Mayor, and that is just, it comes from wholeheartedly. Let me tell you, it really just helps all of us just get into one page, one voice, where unity, red, white, and blue signifies our nation. And right now, I do believe, I love your idea about lighting up City Hall. I think that that's something that we should do for every holiday. And so as
That was
staff
Renee's
looks at,
idea.
yeah, thank you, Renee.
I love that,
it.
yeah.
You know, if you could add some giant colors in there, that'd be great. But definitely, I think that that does bring unity into the city, especially in a place where it's been tough for all of us. So thank you again so much, Mayor and Vice Mayor, for your sentiments on that, and for definitely listening to our pleas. Renee, you are a jack of all trades, and you are the fierce warrior that I met many years ago. And I know that if there's somebody that could bring some spirit and some happiness into the city, that's you. So please know that I thank you for all of the work that you did on the presentation. You know, to our firework, some company that I know we've been working with for a really long time. Thank you if you're watching for understanding. You know, definitely this is a tough time. It breaks my heart. My daughter and I, we go to this every year with my nieces and nephews for the past 19 years. So it's definitely a different tradition that we're going to start. So I'm looking forward to that. Thank you, everybody.
Thank you very much. All right, I'll ask members to lower their virtual hands. And so I think this is great. I think we funded the COVID-19 tests, and I think we defunded the fireworks display. And so it's really prudent leadership among the vice mayor and the council here. Certainly, it's good for the budget to make these decisions here. So I want to thank everybody for that. We'll go back to Renee here. Please tell us what you need. Do we need a motion or any? You got all your notes? Any questions you have of any of us?
So I do need a motion on the option that you would like to go with. What I'm hearing is that there will be no fireworks display, but you would like to go forward with the virtual event. So I think that the motion related to that will allow us to budget and move the saved money into Walter's camp too.
So I'd like to make that motion, especially for Walter.
I'll second it.
We got a motion by Vice Mayor Bob Nunez. We have a second by Councilmember Carmen Montano. All in favor. Virtual roll call. Councilmember Fan.
Aye.
Councilmember Montano.
Aye.
Councilmember Dominguez.
Aye.
Vice Mayor Bob Nunez.
Aye.
Aye for myself. The motion is carried. Thank you very much, Renee, city staff, everybody involved, police, fire, everybody. We will have a 4th of July here, and we're gonna have to do it in a certain twist. And I know there may be new ideas here and there along the way. Everybody connect with Renee, and you know, it's always great to have creativity during these times. So thank you very much, Renee. I appreciate you. Okay, great. All right, let me pull up my agenda here on the iPad. Okay, agenda item number 3. Let's receive a staff report and approve staff recommendation to provide funding in the amount of $3,000, which will be distributed evenly to the Lions Executive Club and Milpitas Rotary Club for the purchase of face covering supplies for a community need. Thank you. Okay, looks like Mike's pulling up a. Okay, it says here we have Renee again. No.
Me for one more item.
And Mayor, before Renee presents, because we do have some conflict questions on this one, I just wanted to resolve them for the council. We did do some quick research. For anyone who's a member of either the Lions or the Rotary, you could stay seated, but we would just note for the record, and I think that is Councilmember Dominguez and Councilmember Montano who are members. For anyone who's a board member of either organization, we would need you to recuse yourself. If we had more time, we could look at whether there's actually a financial connection between the board seat and the organization, which I assume there is not. But to be most cautious, I would just recommend Vice Mayor Nunez, if we could, if we could just mute him and turn his camera off, or if he can do that on his end. And
I can do it.
We will bring him back as soon as we are done with this item.
Okay.
All right.
All right. Well, good evening again, Mayor and City Council members. We'll go to the next slide and dive in. So as you all know, the COVID-19 pandemic, huge global impact on social and economic environment. It has
I hear somebody
created-
pouring.
Oh, so sorry. That was me.
So since April 3rd, to stop the asymptomatic spread of COVID-19, the CDC and our county public health have been recommending the use of face coverings by individuals when in public. COVID-19 has a high rate of transmission, including those that pass on the virus without even knowing that they are infected. Face coverings per these recommendations refer to bandanas, scarves, towels, or other pieces of cloth or fabric worn over the mouth and the nose. The face coverings do not replace the need for social distancing and should be used along with social distancing and frequent hand washing to prevent the spread of COVID-19. Medical and N95 masks and non-latex gloves are still to be prioritized for first responders and medical staff. And face coverings are not recommended while exercising, as they may cause breathing issues. And they are also not recommended for children 6 years old or younger, or anyone with breathing difficulties. After these guidelines and recommendations went out, city staff has been encouraging residents to make their own face coverings at home via tutorials and on the city's virtual community center. Next slide. At the April 21st City Council meeting, Council directed the city manager to send an order mandating face coverings in certain essential businesses in Milpitas. The county issued a similar order, which became effective on May 4th. At the same meeting on the 21st, Council directed staff to look at the potential of donating city funds to assist those community organizations helping with the distribution of face coverings. Next slide. Milpitas Lions Executive Club and the Milpitas Rotary Club have been working together to provide face coverings to Milpitas residents and are accepting donations of funds, materials, and pre-made masks now. 2 free face covers are provided per household while supplies last of this effort, and community members have been asked to email milpitasmasks@yahoo.com to receive their free face covering or to make donations. Information on Milpitas Masks effort has been shared via email, city website, and social media pages in English, Chinese, Spanish, and Vietnamese. Next slide. It is anticipated that the use of face coverings will be required for a long period, likely until there's a vaccine for COVID-19. With face coverings required and essential recommended for individuals in high public settings, the demand for the coverings are high. The Lions Executive Club and Rotary estimate that they can make about 200 masks per week. Each mask costs approximately $3, so the cost per household at their 2 per household limit is $6. Individuals, nonprofits, and businesses have already made donations in the form of face coverings, supplies, and funding. Based on the capacity of the community effort, donations from other entities besides the city, and the fact that the community will acquire face coverings through their own means, neighbors, family members, etc., staff is recommending a donation of $3,000. This will provide 1,000 masks for at least 500 households in Milpitas. We want to be clear, it's not anticipated that Milpitas Masks Initiative will meet the needs of all residents in all households, but will provide face coverings for those who may not be able to access them in other ways. So although this is a fraction of the total number of households, staff is recommending this amount based on the capacity for producing the mask and the fact that donations are being provided by others in the community. Next slide. So for Fiscal Impact, there is currently funding in the amount of $15,349 in the City Council Community Promotions allocated budget line item, budgeted for the annual library essay contest, event, plaques, and awards, and other expenditures. This appropriation is generally used to provide donations for fee waivers for the community groups and would be an appropriate source of funding for this initiative. Next slide. So in summary, the recommendation tonight is to receive the staff report and approve the staff recommendation to provide funding in the amount of $3,000, which would be distributed evenly to Lions Executive Club and Rotary Club for the purchase of face covering supplies for.
Thank you so much, Renee. Got my digital agenda here, but I'm thankful for your presentation and report. I'll go ahead and lead this one off. I just want to say that this is a exceptional partnership between the city and the community, and I'm thankful for our Lions and Rotarians. It's really a collective effort here as we work through this in the month of May, and I keep my support open for any other organizations that can take the same leadership that the Lions and the Rotarians are truly doing, very exceptional. So next up here, we have Councilmember Carmen Montano.
Yeah, I really like the idea that for us funding service organizations to help out in distributing the masks. So I really just want to say that I really do support this effort. And as you all know,
yeah,
here's a mask.
Ooh, I like that one.
So Anthony, I have a question for Anthony. Anthony, do you have a mask already? Anthony?
Yeah, I do. Yeah.
Oh, because I got a kitty cat one for you.
Oh my God.
I got a kitty cat one for you. Anyway, if you want it, just let me know. But yeah, I support this. I
that's very
support
cool.
this. I support
Thank
it.
you.
All right, looking for any further virtual hands? If not, I'm looking.
All right.
Councilmember Dominguez. Your microphone, yes.
So much. Definitely so much again, staff, for moving forward the vision. I love it when the vision starts and it ends up being something so much more magical. So thank you guys. This is definitely a community effort. And so I was wondering if I could go ahead and move to motion to go ahead and move the motion forward. If that's something that I would be able to do at this time, Mayor.
Yeah, I think so. That'd be great. I don't see any further virtual hands. Let's go ahead and do it.
Awesome, thank you. So at this time, I'd go ahead and like to move the motion.
A second.
Thank you.
We have a motion by Councilmember Dominguez. We have a second by Councilmember Montano. All in favor of agenda item 3 on the special meeting. Roll call here. Councilmember Pham.
Aye.
Councilmember Montano.
Aye.
Councilmember Dominguez.
Aye.
And for myself, aye. And this motion is carried and approved. Fantastic work, everybody. Councilmember Montano can only make so many masks. Yeah.
Yeah, really. And I want to thank Councilmember Dominguez for bringing that idea up about having some type of a mass distribution. So thank you for that.
Can I have a calaveras one, please?
Yeah, actually, I got one left.
Oh, yes.
Okay.
Thank you.
Okay, welcome back, Vice Mayor. As the board member of one of our great community groups, many of which you sit, you recused yourself as oftentimes you do with nonprofits. And so thank you for your work too as a board member. Okay, fantastic. Well, we're gonna keep this thing moving along here tonight. Thanks for everybody tuning in. I see on my different screens, I got my different platforms. I see everybody online, residents of Milpitas family, Milpetians. We are done with this special meeting, but hold tight. We're going to come right back with the the regular meeting. We're going to open that one up. It's a double header tonight. You got 2 meetings. And so we're going to adjourn this one, and then we're going to go to our next regular meeting, and then go to our closed session, and then come back from closed session, and then we're going to have a heck of a night. Thanks for tuning in.
Mayor?
Yes, Vice Mayor. Yeah.
Yeah, if I could just real quick, I noticed on the agenda it says we're going to adjourn this meeting and then open the next one. So I know today is would have been Denny's 90th birthday. And so if we could adjourn today in his honor and then adjourn the next meeting in his honor today, I'd appreciate that.
Yeah, absolutely. Thank you very much, Vice Mayor Nunez. We will adjourn this meeting per the request of the Vice Mayor, Bob Nunez. Adjourn this meeting in honor of our former mayor, 5th Mayor Milpitas, Denny Weisgerber, and it's truly fitting that it follows an agenda item that deals with our Milpitas Rotary Club. So we're thinking of Denny tonight as he's celebrating his 90th birthday upstairs. This meeting is adjourned.
So do we log off?
Yes, you will need to log into the next meeting now.
Okay.
6
and
Are we
o'clock.
going to close
And
session?
Are you gonna send me that code?
Rochelle should have sent you a note to
Okay, let me see, let me check.
go into the Zoom meeting that starts at 6 because I have to call the roll call. Okay.
Okay, thank you. Let me get out of there. Leave meeting.